Hello everyone, and welcome back to the channel today. We have some urgent health news coming out of Ethiopia that we need to talk about. The Ethiopian Ministry of Health has officially confirmed an outbreak of hemorrhagic fever in Jinka town, which is located in the recently formed South Ethiopia regional state. This is a developing situation, so let's break down what we know so far, what the authorities are doing, and most importantly, what this means for public health and safety in the region. First, the official numbers as of the latest statement released this past Wednesday. There have been 8 suspected cases identified. 8 might not sound like a huge number, but with a serious illness like hemorrhagic fever, even a single case is a major cause for concern. The term hemorrhagic fever is actually a broad category for a group of illnesses caused by several distinct families of viruses. You might have heard of some of them, like Ebola or Marburg. These viruses can cause severe, life-threatening diseases, and they often share similar symptoms, which makes early detection and specific identification absolutely crucial. In response to these suspected cases, the Ministry of Health has acted swiftly. A rapid response team has been deployed to Jinka. This isn't just a small local effort. This is a coordinated national response. The team's primary objectives are threefold. First, to figure out the exact cause of the outbreak. Second, to conduct extensive laboratory testing on samples from the suspected cases. And third, to implement immediate measures to prevent the fever from spreading any further. This is a critical time, and the actions taken in these early days will largely determine the trajectory of the outbreak. The ministry has also emphasized that this is a collaborative effort. They are working closely with various partners to ensure a comprehensive and coordinated surveillance and response strategy is in place on the ground. This means boots on the ground public health work. Community level monitoring is being ramped up significantly. This involves health workers actively looking for new cases within the community. Contact tracing is another vital component. This is the meticulous process of identifying everyone who has been in close contact with the USPECTED case and monitoring them for symptoms. This helps to break the chains of transmission before they can get out of control. Furthermore, teams are going house to house to actively search for anyone who might be sick but has yet sought medical help. This proactive approach is essential for containing an outbreak like this one. Now, one of the most pressing questions is, what specific type of hemorrhagic fever are we dealing with? As of right now, that has not yet been confirmed. Samples from the patients have been collected and are currently being analyzed in a laboratory. Identifying the specific virus is the key to everything. It will inform the treatment protocols for patients, guide the public health response, and help experts understand how the virus is spreading and how to stop it. Different viruses have different transmission modes and different levels of severity. For example, some are transmitted through mosquitoes, while others are spread through direct contact with the bodily fluids of an infected person. Knowing the enemy is half the battle, and right now, the lab work is the top priority. The ministry has assured the public that they will provide updates as soon as these laboratory results are available. In the meantime, the Ministry of Health has issued clear and important advice to residents in and around Jinka. If anyone experiences symptoms such as unexplained bleeding from the nose, gums, or skin, a high fever, severe diarrhea, or vomiting, they are urged to seek immediate medical attention. These are the classic telltale signs of hemorrhagic fever, and delaying care can have serious consequences, not just for the individual, but for the community. Early diagnosis and supportive care can significantly improve outcomes beyond seeking medical help. The ministry is also stressing the importance of public vigilance and strict hygiene practices. This is something everyone can do to protect themselves and their families. Regular and thorough hand washing with soap and water is one of the most effective ways to prevent the spread of many infectious diseases. They are also advising the public to avoid direct physical contact with anyone who is showing symptoms of the illness. This includes avoiding contact with their bodily fluids, like blood or vomit, which are often highly infectious. The response isn't just at the community level. It's also happening within the healthcare system itself. Health facilities across the entire region have been put on high alert. They have been given instructions to strengthen their patient screening processes. This means every person coming into a clinic or hospital will be checked for potential symptoms. Any suspected cases are to be immediately isolated from other patients to prevent transmission within the healthcare setting, and, of course, there's a mandate for the prompt reporting of any new suspected infections to the central health authorities. This creates a real-time information flow that is vital for tracking the outbreak and allocating resources effectively. This situation in Jinka is a stark reminder of how quickly public health emergencies can arise, and why strong, responsive health systems are so important. The coordinated efforts of the Ministry of Health, its partners, and the community are the best defense against the spread of this outbreak. We will be keeping a very close eye on this story and will bring you updates as soon as more information, especially the lab results, is released. For now, our thoughts are with the people of Jinka and the healthcare workers on the front lines. Thank you for watching. If you found this update informative, please give it a like and consider subscribing for more news and analysis. Stay safe, and we'll see you in the next video.